Let me welcome you on a pretty somber occasion. I'm Ashutosh Varshney, Director of the Center for Contemporary South Asia, here at Brown's Watson Institute. And this is a special webinar on the COVID-19 crisis in India. And not only are we trying to understand what happened, but more importantly, what can be done now. A virus-ravaged country, hospitals running out of oxygen and unable to save patients, orange flames leaping out from overworked crematoriums where people are lining up for hours to cremate their dead. These images have dominated the news cycle as the epicenter of the COVID-19 pandemic moves from the United States last year to India now. Just a sense of data first. Last year, the United States, having 4.3% of the world's population, had 20 to 25% of the infections worldwide, depending for much of the year. And at this point, India, which has 17.5% of the world's population, has an estimated third of the worldwide infections. Accuracy is hard to come by. These are estimates based on reported infections worldwide and reported infections in India. Since India is 4 times as populous as the United States, the implications of its suffering are very serious, very grave. All suffering causes concern, but the magnitude in India, if it worsens, will be, as I said, very serious and very grave. To understand how we got here and what can be done, we have 2 of the ablest minds as our panelists. We will start with Barkha Dutt, speaking to us from Delhi, from her studio. Barkha is a senior journalist in India, is a Washington Post columnist, and has been reporting tirelessly on COVID for over a year. From the highways, watching migrants walk hundreds of miles to reach homes, from hospitals, from crematoriums, from burial grounds. She was a Meera and Vikram Gandhi Fellow at our center, in fact, the first Meera and Vikram Gandhi Fellow at our center many years ago. This is her 3rd seminar at our center on COVID, and we view her as part of Brown's extended family and community in India. Thank you, Barkha, for joining us again. Our second panelist is Ashish K, a faculty fellow of our center and dean of Brown's School of Public Health. After being at Harvard for 16 years on its faculty at the medical school and the School of Public Health, he joined Brown last September and has appeared regularly on America's TV networks to educate us almost every single day about COVID in the US, and has maintained a very active interest in India, where he was born and where he lived till he was 9 years old, until migrating to Canada and then the United States. After each of these panelists has spoken for 7 to 8 minutes, we will have Q&A. It will be, I'll start the Q&A, but if you have any questions, please use your Q&A function to send it to us. Bhanu Joshi will be monitoring the questions and will read out some, depending on how much time we have. We'll certainly have some audience questions. So we look forward to what your curiosities, concerns, and anxieties are, and we'll have Barkha and Ashish respond. So let's start with Barkha Dutt speaking to us from her studio in Delhi. Barkha.
Thank you, Ashu, and to everyone who's joined in. This is probably one of the most important conversations that I'm having today. And Ashu, in his introduction, said, "I've been reporting from highways, from crematoriums, from hospitals, from ICUs, all of which is true. But I never thought I would be reporting from the place I've just come from, literally a minute ago to join this webinar. It's a gurdwara about an hour out from the capital. A gurdwara, as I'll still explain it, is a place of religious worship for the Sikh community and often opens its doors to the needy in times of crisis. The langar, or the food that is distributed at the gurdwara, is usually what the poor go and eat when they can't get food. I just filed a report, a ground report, on an oxygen langar. I never thought the day would come when I would witness something like this in my country. There is an oxygen langar. I went to find out what this is. And it is among the most horrifying scenes that I have witnessed. And I've seen some horror in the last few weeks. Basically, ordinary citizens who cannot get hold of a hospital or a bed or an oxygen cylinder or an oxygen concentrator are now driving to this gurdwara, which has giant cylinders placed on the road outside of it, where the cylinder then straps itself. I mean, someone comes and straps a pipe from the cylinder. You sit at the back of your car, you take a few puffs of oxygen, and you're able to breathe again for, well, a few more hours. And the scenes I saw were of old women, elderly men, their children crying, weeping, saying the SPO levels are down to 50, down to 60, save her life, save him now, now, now. And this understaffed gurdwara with a handful of volunteers running out, carrying oxygen cylinders to the main road outside of a place of worship where people are coming to get a few puffs of oxygen. It's like every bad science fiction movie is now the truth of India, and then some. How did we get here? We got here, among other reasons, because as a country and as a state, we declared victory too soon. We were complacent, we were callous, we were ignorant, and we were casual. We were casual enough to dismantle jumbo COVID facilities, an excellent idea from last year. Because remember, when hospitals have limited beds and when hospitals are only handling COVID patients, we're not even stopping to think that there are people dying of other diseases as well, cancer, kidney disease, and so on. Suddenly, the non-COVID poor in particular have nowhere to go. And the numbers of those who are COVID positive also have nowhere to go, because hospitals that were 500 beds, for example, let's say an average size of a big hospital in a big city, now don't have space. So we must be asking the questions, what happened to those 1,000 bed, 3,000 bed facilities that were created last year? Where did they go? Why did we start gifting our vaccines before analyzing how many we would need at home? And I must confess to being one of those who leapt up. I was lulled into feeling quite proud, feeling like this was some counter-colonization moment. Oh, here India was manufacturing vaccines that Britain was now dependent on us for. I think we let some sort of childish national pride get the better of us there, and we were not ready. We should not have been giving away those vaccines. We over-centralized the vaccine rollout to states. We had the central government determining how many vaccines which states should get. It seemed a no-brainer to me that when Maharashtra had the most cases, it should have got the most vaccines. It also seemed elementary to me, and there were many people like Kiran Shaw, for example, who advocated very strongly that the working population, which is going out and working, because remember, we did not have a national lockdown this year, is very vulnerable and it will be taking the virus home. We should be vaccinated. We need to not think like the Western world. We need to be vaccinating the working population and not just the elderly. That was disregarded. We have now done a complete about turn, and from over-centralizing the vaccine program, we've now told the states to fend for themselves and go and purchase the vaccines for themselves. So a complete flip-flop there. And finally, the sheer mixed messaging, the poor communication, the lack of respect in continuing with mass congregations, the lack of respect for human life, the campaigning that continues on this day that I speak with you. There is voting that has taken place for local elections in Uttar Pradesh, India's most populous state, and there is voting that has taken place in the eastern state of Bengal. And whether it's regional leaders of Bengal, the opposition leaders, or it's the Prime Minister and the Home Minister, till a couple of days ago, they continued with that campaign. And we are now at a point where one of our high courts has said that the Election Commission is responsible for murder. Those were the words that were used by the Madras High Court today for the Election Commission. You are responsible, they said to the Election Commission, for allowing these rallies to take place. The Kumbh Mela that took place in Uttar Pradesh, hundreds of thousands, if not more, people gathering on the banks of the Ganga, and this just carrying on while you're trying to have a police-enforced curfew lockdown on individual citizens and wagging your finger at those who don't wear masks inside cars, even if they're alone in the car. So it's you know, a doctor told me that when somebody dies because you can't administer oxygen, it is not a natural death, it is murder. Another doctor told me that I feel I've been sent into a nuclear war with a lathi, which is Hindi for a stick. It is not the fault of doctors and it is not the fault of hospitals, but people's pain is turning to fury. Their helplessness is turning to rage. People are being made to sign consent forms. I met a 21-year-old boy at a public health hospital in Delhi, and his father died, but to get his father a bed, he had to sign a form that said if his father died from the absence of oxygen or a ventilator at the hospital, it would be no one's liability. Across hospitals in India, similar consent forms, I need to say consent forms, are being signed. I called them in my Washington Post column modern day death warrants. You're giving people no choice. You are saying to them, if you want a bed, you will consider the fact that you may die, not because there's a medical risk, which there is with any procedure, but because there is no logistical backup. The hospital doesn't have what it should have had. Finally, there has been a great pushback from the right-wing supporters online against the reportage that some of us have done, including myself, from crematoriums and graveyards. You would have seen the aerial photographs of the funerals on the front page of the New York Times. I was reporting from that same funeral site last night. And we are being called vultures for being at these cremation sites. And I want to say to the larger audience here, and it's really important that the world understands this, if you do not go to these burial grounds and cremation sites, you do not find the gap between the official data and what's actually happening on the ground. So to give you a couple of statistics, I was in Surat in Gujarat, the textile town, the Prime Minister's home state. And at a single site, the undertakers told me that they had cremated 100 bodies that one day at one site. That particular day, the entire state of Gujarat reported 78 deaths. In Delhi, the undertaker at that funeral site that you saw on the front page of the New York Times told me he had cremated 133 bodies. Delhi was reporting much fewer cremations. In Ghaziabad, in Uttar Pradesh, I counted 20 bodies in 1 hour at one site. The entire district reported 8 deaths. One of our best known virologists, Shahid Jamil, speaking to me in tears, and more than one doctor I've interviewed in the last 10 days has cried openly, said that the data is skewed, it's underreported, it's manipulated. Another prominent person, Dr. Velumani, who owns ThyroCare and has laboratories that conducts tests, told me that if laboratories start sending positive results, they get a phone call, he didn't say from whom, saying slow it down. The gap between the time that swabs are given and that results are coming is sometimes 4 to 5 days. Without a COVID positive result, even if there was room in a hospital, you would not get a bed. Doctors are now having to diagnostically treat. People are now kind of treating themselves. And forget space for the living. I met a poor woman at a public hospital who told me that she spent 12 hours looking for an ambulance to carry her dead daughter-in-law's body to a crematorium, and she was not able to find one. And the rage of the poor in particular is turning against hospitals, which is wrong, but it's inevitable. because they are like orphans of the state. At the gates of these hospitals, there is no one to talk to them. The doctors are overstretched. We don't expect them to be the ones doing the talking, but where is the state? This is exactly what happened with the migrant workers as they fled in 2020, and in 2021, I have never met a representation of the state. There's no centralized coordination for ambulances, for which hospitals may have space, for which hospitals may not have. And I could go on, but I'll pause here by saying that I met the mother of a 1-day-old baby, not 1-year-old baby, 1-day-old baby at a hospital yesterday, where the mother was COVID positive. The 1-day baby had to be handed over to relatives, and she was going from hospital to hospital looking for help. We are in a period of calamity, of mourning, of emergency, of collective grief, of helplessness. We are a nation on tenterhooks. We are a nation with a hollowed out heart. And if anyone is going to tell us today to be positive, I will personally pick up something and throw it at them, because I think that's just a callous, tone-deaf remark to make, because this is just the beginning. Some states are plateauing, we hope, Maharashtra, after peaking, but this is probably going to, Ashish can weigh in on that, this is probably going to move state by state by state. And we don't even know what's going to happen in our tier 2 cities, our smaller villages yet. Right now, we're talking about a health system that's collapsed in our metropolitan cities. Can you imagine what's going to happen when this moves? It probably already has into our Mufassal towns. In my living memory, I have never seen India gripped by this level of despair. I'll pause there and listen to what Ashish has to say, and then be glad to take questions.
Thank you, Barkha, for this report. Ashish?
Hard to follow that, Barkha, but thank you for the extraordinary work in teaching all of us. For so many reasons, the work you're doing, the helping us understand what is happening on the ground, but also bearing witness to what India is going through. And I will not say be positive, but I will say that we have the tools in our power to turn this around. But they are not easy ones to wield, and there's a lot of complexity, which we will want to get into. Let me do a little bit of reflecting on where India has been in the last 3 months. And Ashu, since we are here together under a joint event between this CCSA and the School of Public Health, I reflect back to a talk I gave to the Center for Contemporary South Asia on January 29th. And ostensibly, it was about how did India beat COVID? And I walked through 5 or 6 major theories. And at the end of it said, none of them quite make sense. I don't know exactly how to explain the low number of cases, but it is not really possible that India has beaten COVID, because it is not possible, because there are things we know about the virus. We don't know everything about the virus, but there are things we know. 2 weeks later, as best as I can tell, was sort of the bottom and the nadir of sort of the number of new infections. India had less than 10,000 infections on February 11th, and things looked quite good. 2 months ago today, February 26th, that number was up to about 18,000. And anybody who understands this disease would have been alarmed by a doubling of the number of infections in 2 weeks. But these were small numbers, and it was easy to ignore. And things have just marched nonstop from late February. So I think you can be excused in late February of not seeing that early signal of the uptick. By mid-March, it was no longer ignorable. And by the end of March, it was very clear where India was heading. And of course, in the last few weeks, things have become quite calamitous. We are now up to about 350,000 infections per day, with a test positivity about 23% nationally, which says to me that the true number of infections is maybe 3 times that. So if you ask me how many people are actually getting infected in India every day, I would say it's at least 1 million. That is the true number of infections. It could be a bit more, a bit less, probably not much less. So at least 1 million infections a day. The official death toll is 2,500 to 3,000 a day. I think there is so much evidence that the true number is substantially bigger than that. I have estimated maybe 5 times that, maybe 10 times that, maybe not, but 5 times would get us to 12, 15,000 deaths a day, which is probably where India is right now. So let's talk a little bit about how we got here. And there is a political element, which I will largely leave, not my, I don't know that I have anything particularly insightful to say, but let's talk about from a public health point of view, how did we get here? So here's what we know about the virus as of today. This is a virus that's still new to us. We as humanity have really known about it for about 15, 16 months. What we know is that the virus likes to spread when people are in close distance, when people are inside particularly, though large packed gatherings of people outside can also spread the virus quite efficiently. We know that that when you wear a mask, you dramatically reduce the risk of both spreading it and getting it. We know that if you do wide scale public health testing and test large populations, you can identify infections early, because one of the Achilles heels of this virus, it's very unlike most viruses, is that much of the spread happens when people have no symptoms. This makes it a very, very difficult disease to identify from a public health point of view. So a very aggressive, proactive surveillance program is very important. And if you look at what has happened in India over the last few months, we've seen, and Barkha has really done a brilliant job of documenting so much of this. We've seen the political rallies, we've seen the Kumbh Mela, we've seen packed stadiums with cricket matches and movie halls, all the things that one cannot afford to do in the middle of a global pandemic. And we did all of those things in India. So they clearly were major contributors to what has happened. There is also another set of issues that I want to just quickly talk about. And by the way, on the mask wearing, it has been really striking to me. Even in January, there were videos of people burning masks and saying, we have moved on from masks. Some of the nonsense we saw here among right-wing places in the United States, some of the same nonsense you've seen in places like in Europe, also found its way into India. I want to talk a little bit about variants, because they get a lot of attention. And I want to talk about what we know and what we don't know. And I will start by basically saying, I think there's a lot more we don't know than what we know. India is doing a very inadequate job of genomic surveillance. India should be sequencing, genomic sequencing, ideally 5 to 10% of all infections. It is doing well less than 1%. The point of genomic sequencing is it lets you track the disease. It lets you figure out where are things spreading, which variants are spreading where, and gives you a lot of insights into where things will go next. We don't have that data. To the extent that we have some data from India, we have, of course, data on B117, that is the variant originally found in the UK. And in many places, that is quite prevalent. And I think it actually probably has been a major source of why things have exploded the way they have in India. So that's not the Indian double mutant, which I will talk about in a second. That is the UK variant that is now the dominant variant in the United States. It's the dominant variant across Europe. It is probably the dominant or one of the dominant variants in India. But I say that with some uncertainty because we don't have very good data. So let me just go ahead and address the double mutant question, because my goodness, if I get asked one more time, is it the double mutant? I don't even know what is meant by double mutant. So let's talk about mutations. Mutations are very common with this virus. The two major mutations that the double mutant has is, and I'll just give you the technical, they're both on the receptor binding protein of the spike protein. So let me explain. The virus has these spikes, it's a coronavirus, has these spikes sticking out. The spike sticks to a human cell receptor called the ACE2 receptor. And where the virus basically attaches to the human cell is the receptor binding protein. And that has, and there are two major errors that this double mutant has. One is the L452R mutation, and the other was the E484Q. People don't need to remember this. But the point is, these are both well-known mutations. We have not seen very many strains of the virus with both of them. And my best guess of what these mutations are doing, and it's a guess because we have to do the functional studies, so we're not guessing and we actually can look at real data, is that they probably cause a little bit of immune evasion. So for somebody who's been previously vaccinated, they may have some more breakthrough infections. For somebody who's been previously infected, they may have some breakthrough infections. But it does not in any way suggest that our vaccines are going to be no longer useful. There's been all this talk of somebody got vaccinated and then 4 days later they were positive. You're going to see some breakthrough infections. And I am worried actually in the pictures that I have seen of vaccination halls and vaccination sites that there may actually be some amount of spreading happening. They're not doing always such a great job of keeping people socially distanced. But nothing about the double mutant makes me worried that either Covishield or Covaxin will be ineffective against the double mutant. So I think vaccines are still our very powerful way of controlling this. Let me take just 2 minutes to talk about where the future is. So right now we're at 350,000 cases. We are seeing a plateauing in Maharashtra, in Delhi, in a few other places. I am hopeful, but not excessively so. And let me just say a bit why, even for those places. Maharashtra may actually be a true plateau. In Delhi, for instance, we've seen a plateau of cases, but we have seen a huge increase in test positivity. The way to think about test positivity. So in Delhi, the test positivity is over 30%. That is an astronomically high number. It means every 3 tests you do, you find 1 case. In America right now, which has a lot of infections, test positivity is 4%, or for every 25 tests you do, you find 1 case. When you're finding cases that easily, every 3, 1 is positive, you are missing a vast majority of infections. So Delhi's numbers are even a more dramatic underestimate of what is happening. But again, then once you get out of places like Delhi and Maharashtra and you do get into UP, and my family is in Bihar, I talk to cousins and others in Bihar, testing is not widely available. And so even if somebody gets sick, nobody's getting tested. So the numbers are highly unreliable and clearly a huge underestimate. I will finish by only saying there are a lot of models out there. IHME, the ones at the University of Washington, put out some very scary models yesterday suggesting that you're going to see tens of thousands of people dying every day. I don't know where things are going. What I know is this is not going to turn around in the next few days. I had a conversation with a senior health ministry official in India on Friday who said, well, you know, maybe 3-4 days of difficult times, but maybe by end of next week, things will be better. And I didn't really know where to begin on that. It will be many, many weeks of things likely getting meaningfully worse. And the problem is the hospitals are already full and a majority of the infections have not gotten sick enough to need hospital care. Where are all those people going to go? And we have not much a way of a strategic plan. There are lots of things we can do to get better, and I'm not going to get into that list because I do want to stop and get into a discussion. But the next 4 to 6 weeks are more or less baked in. They're going to be very, very hard for India, calamitous. And the question is, what do we do now so that things start really getting better in a meaningful way once we get out of these next 4 to 6 weeks?
Thank you, Ashish. Let me ask Barkha if she has any questions for Ashish.
You're muted.
I agree with everything Ashish has said, and I was particularly struck by that health ministry official who still has a sort of an ostrich-like head in the sand. This is what is really exasperating. I understand that people need good news. I understand that people need hope. I get that, but it can't be repeating the same mistake that we made last time. But Ashish, my question was something different. We're almost able to anticipate in some ways where the next set of peaks might come. Do you believe that the vaccine program needs to be targeted? This is something some of us had argued when Maharashtra was the worst hit. And at that time, the central government had declined to do that and had determined on its own, whatever strategy, how to distribute the vaccines. Could it be that we should be anticipating states? So, for example, almost everybody believes that the repercussions of these mammoth gatherings are going to be felt in Bengal. And we may be too late to contain UP, but we might not be too late to contain Bengal because it could take a month for that catastrophe to play out. Should we be targeting vaccines in a more strategic way now?
Can I add a little bit to it, Ashish? Bengal is the third largest state of India. So we're talking about a very large number of people. UP, Maharashtra, and Bengal now has become the third largest. Second, there is also news you might have read appearing in Indian newspapers that the positivity rate that you said for Delhi seemed like 25 to 30. It's 25 to 30% for the entire state of West Bengal, the most recent, and 50% for Kolkata. First of all, do you believe that it could be 50% for a city as large as Kolkata? And secondly, do you think, as Barkha asked you, whether the targeting should be Bengal now, and likewise?
Yeah, so targeting is a very smart, very good policy idea. There have been lots of outbreaks in history that we have helped to bring to an end by doing things like ring vaccinations. You find the person who's infected, and then you vaccinate the people around them who have not yet been infected. There are those kinds of strategies. The challenge now is where to put that energy. For all the reasons you laid out, Ashu. Like Bengal seems like a perfectly good place, but it is huge. A 50% positivity in Kolkata means that's basically New York in late March of last year, when we had almost no testing capacity and infections were everywhere. At a 50% positivity, you're missing 90% of cases. You can do a mental model that says, take the number of cases you're identifying and multiply it by 10. And that's probably what the true number is, 9 or 10, right? So in that context, it feels like Bengal is already aflame. And first and foremost, you need very, very strong public health measures. But protecting older people, protecting healthcare workers in places where you think these flames are kind of going next is perfectly reasonable. So I would be generally supportive of that. But I think when I look across India, and again, Barkha, you have a better feel of the data on India, or maybe not, but you certainly have been staring at it very, very closely. I feel like there's so many places aflame right now that I don't know how to do targeting very effectively.
Yeah.
But I agree with you that if they had acted on Maharashtra a month ago, it would have made a big difference.
Yep. Yeah.
Here is some data. Barkha, did you have?
No, I just think in aggregated, you see, we're not sure. We're going to find out on the 1st of May that we have enough vaccines for a universal vaccine rollout, right? If we did, then I wouldn't need to be talking about targeting. I am assuming at this point that we are short on vaccines because 3 weeks ago, when people were going for their second dose, they weren't getting it. Even today, our team has reported from vaccine centers in smaller hospitals where the second dose is not available, right? So I'm going to assume that we are going to be short of vaccines on the 1st of May. And therefore, I would like the epidemiologists, I would like people like Ashish to tell us where. I just am not convinced of an aggregate one-size-fits-all sort of rollout without a plan. But that's what's happening. That's what's planned right now.
Yeah. Can I add something to it also? One more thing, Ashish. So this morning, New York Times reported, based on the Oxford Global Model, I think that's what it's called, the following about vaccines. And we need to hear you on vaccine rollouts now. 82% of vaccine shots have been given in high income and upper middle income countries. So I can do this calculation with development statistics for you that's largely available. So roughly 50% of the world lives in upper middle income countries and high income countries. And roughly 50% lives in low income countries and lower middle income countries. These numbers were very different. Of course, China has become an upper middle income country. India has become a lower middle income country. But the low income country, this group was very large until some years ago, but now it's about 10% of the world. But if you add the lower middle income, that's roughly half of the world. This study, Oxford study that New York Times cited this morning, is saying that 82% of vaccine shots in the world have been given to upper middle income countries and high income countries. And in particular, in the low income country, which has 10% of the world, only 0.2% of vaccine shots have been given, and the rest, let's say about 17% in the lower middle income countries, including India. For India, they are saying that only 8.6% of India has been vaccinated with one shot yet. It's about 100 million people only in a country of 36 billion. So as you think of vaccine rollout, the question that Barkha asked, are we thinking only about national provision of vaccines, or the world community also has to play a role? And especially, what does WHO have to do, if anything at all?
Both a fabulous and very multifaceted question, Ashutosh. Let me try a few different parts of this. Yeah. So if the question is, what is the right global strategy? What should we be doing? The idea of healthy 16-year-olds in Newton, Massachusetts getting vaccinated, where healthcare workers on the front lines in much of the world do not have access to vaccines, is ridiculous, terrible, a statement of the deep global inequities we have. The problem is everybody says that, and very few people are willing to do anything about it on some very practical level. So the only 3 countries, and now really 2 countries, that have been willing to give out large amounts of vaccines to other countries before their own people get vaccinated. I mean, till recently, it was Russia, China, and India, and now really Russia and China, because of course India is trying to focus on its own issue. And the US is in a very interesting position, because in the US now, anybody who wants a vaccine can get one today. Any adult, anybody over 16. It's just ubiquitous. So the US has to start playing a very, very different role. And the Biden administration has focused the last 3 months fully on getting Americans vaccinated. And I think we can discuss that. But now the attention absolutely has to turn to global vaccinations, because this description that you have, basically it's 5 or 6 countries that have done almost all the vaccinating, leaving 180 some odd countries, 190 some odd countries, depending on how you measure, out of the mix. So to your question of what is the role of WHO, WHO has been banging this drum, has been talking about global equity. There is the COVAX facility that has been jointly developed with Gavi, but none of that is going to work if people are not willing to donate vaccines, and they just don't have much in the way of vaccines to give out to the world. So I do think, and I'm happy to get into the details of how, but we do need much more aggressive action on global vaccination. And to be perfectly honest, I think the country that can really lead this and drive this is the United States. And the Biden administration is, I think, fully aware that it is their moral and other responsibilities to do so. And I'm hopeful that we're going to see real actions in the next couple of weeks. I don't have anything to say about the fact that we have not seen much action yet.
Can you tell us something about this is reference to your Washington Post op-ed, where you recommended, I think, 3 things the Biden administration has now announced has accepted and announced as part of its action plan. And what it did not agree to is the distribution to India of AstraZeneca surplus, which is sitting somewhere, right? In your estimate is close to 50 million doses or 40 million doses, so it's pretty large. And are such doses, surplus doses, where are these surplus doses beyond the United States also? And certainly with respect to United States, are there some legal / corporate legal implications which need to be overcome before the surplus can be distributed.
Yeah. Yeah, there are different estimates, and I think I had initially tweeted 35 to 40 million. Then I got some pushback from friends in the Biden administration, so I think I wrote 30 million. The bottom line is it's somewhere in the 30 to 40 million doses. They're basically sitting on shelves, I think, in a warehouse in Baltimore, though it could be elsewhere. And they will never get used in the United States. They just won't, because we have so much vaccines now. So what are we doing sitting on these vaccines? The issue is that the contracts that the US government signed with these companies made it very clear that they can only be used in the United States. So then people are like, well, why not just break the contracts? And of course they can, and I think that's fine. I mean, we are in a crisis. But what the government is trying to do is try to figure out a way through the contracts. And the question is, why were those provisions written? And it is largely about liability. That these vaccines, if they are given or lent to another country, and let's say we know that none of these vaccines are perfect. There may be some adverse events. There may even be events that are not related to the vaccine. The manufacturer does not want to spend the next 5-10 years dealing with this in court cases in India or elsewhere. That's the basic gist of it. These are solvable in my mind by basically India offering indemnity and protection against to AstraZeneca, assuming that everything has been done using good manufacturing practices. You're not going to indemnify bad practices, but these are good vaccines. I'd feel comfortable taking it. So I think there are ways of doing this, but it also has a political element of, when I spoke to this Indian health ministry person, his first reaction was, why do we want America's discarded vaccines? So I said, first of all, they're not discarded. We just can't use them for regulatory issues. It's exactly the same vaccine as Covishield, like identical. It's just that instead of the Serum Institute, it was AstraZeneca that manufactured it. And so there are mechanisms, but it's politically sensitive and legally a bit complex. I want to see the Biden administration move on it this week. I don't think that this is something that should take weeks and weeks, given the urgency of the need.
Mm-hmm. And Barkha, a question for you, and then I'll turn to Bhanu and see if there are questions he selected from those that have come in. You've been covering Delhi. You were in Surat, which is also a Class 1 city. You've reported a lot from Bombay. But you did go to Ghaziabad, and you will probably have much better sense of what you call Mufassil towns. Let's call them the grade 2 or grade 3 towns and villages. You'll probably have much better sense than we do, though Ashish has been talking to his family, which is in Bihar, smaller towns. What is the problem there you expect to be greater or not? And how would you summarize? Typically the argument is that villages are not as badly affected as cities because cities are more closely huddled together. There is natural distancing, if you will, in villages, right? So even though they don't have public health facilities of a Delhi or a Mumbai, there is the ground is not so fertile for infections. Is that something you think is wrong?
I would say that cities and towns are more vulnerable because people live sometimes, especially in lower income neighborhoods, 5 to a room, 8 to a room. And in fact, one of the big mistakes of last year's lockdown identified by me was the stay at home slogan to these households. I think there are about 92 million households that live in one-room tenements in India, where staying at home meant telling 8 people to live in the size of a closet. So there is some merit in the argument that rural India does have naturally inbuilt social distancing. However, that does not explain the refusal of rural India to wear masks. We have Ashish. I was interviewing Ashish on my program, and he said at one point, maybe it's different now because of how jolted we are, He couldn't get his cousins in Bihar to understand the gravity of this, and he couldn't convince them to wear masks. And that's where the political communication becomes so important. If you see your big leaders without a mask addressing rallies which are attended by hundreds of thousands of people, how are you going to also convince them that, you can attend this rally, but when you go home in your village, wear a mask, right? The messaging has been tremendously confusing. What I worry about is smaller towns. My deep worry is about, the spaces that lie between the metropolitans and the villages, because I feel that they're crowded and closeted enough to see an eruption, to have entire homes getting infected, and they simply do not have the hospitals. So if the hospitals are cracking and crashing in the big cities, right, where are these people going to go in a Meerut, in satellite towns, right? Where are they going to go? And already at cremation grounds, you are seeing families that have come in from towns that are 2 hours away, 3 hours away. They're driving those distances to try and get medical help. That's already started happening. So that is, Ashu, my big, gigantic worry. And I do want to look ahead and say, and a number of my friends didn't like the fact that I said it, but I think it may be time to deploy the military to run field hospitals. I think we may be at that time where we cannot think geographically. We need to have large open spaces, like in a war. You create field hospitals where you throw your anchor. Similarly, I believe now that we need to deploy the military to run field hospitals, because they have some experience and some training in doing this. And they will not be bureaucratic about it. They will treat it like a war, because make no mistake, we are at war.
Mm. Bhanu, 10 minutes left, 12 minutes left. Do you have, I think we'll have time for maybe 3 questions or so from the audience. Let's start. What have you picked?
Yeah, so I'm going to, so there are about 50 questions in the chat box. I'm going to quickly sort of summarize them.
Yeah, Bhanu, but Grace and John, let's also save these questions and send them out later to our we won't be able to accommodate all 50. Yeah, go ahead, Bhanu.
Right. So I'll put these set of questions for Ashish Jha. And these questions are essentially on what should be the way forward look like. So yeah. Patrick is asking, should we worry about lockdowns? Shailesh Kumar is asking whether is it too late to test and isolate? Should we have localized lockdown? Isam Ahmed is asking, should all economic activity be redirected towards sort of production of oxygen? So that's a question for Professor Jha. And for Barkha Dutt, there are a bunch of questions on the political economy of this entire thing. So Isam from AFP asks, can you disentangle for us the role Modi government in India has played in this mega surge? Has the government helped or hurt these efforts? And what is the effect on the outbreak of censorship that you've alluded to in the past? Jim Turner and Suchitra Kamble have very similar questions. The third and the final set of questions is for the entire panel, which is on where do you see the global approach to fighting this pandemic looking like? So Sanjay Ruparalia asks this question to Ashish, and he says, I quote, Ashish, you have repeatedly stressed that vaccines are working, making effective global distribution vital. Yet we have witnessed a failure of multilateralism, as Ashu highlighted, including continually blocking the petition by India and South Africa to waive TRIPS restrictions at WTO. What is your position on this initiative? So that these 3 sets of questions.
Those are great. Let me start maybe with the first. We'll go to Barkha on the second, and then we'll all deal with third. Yeah?
Yeah. Yeah.
Okay. I'll be very quick about it. If I could wave a magic wand and given powers to deal, it's not, we know what the public health measures are. So let me go through them in very straightforward way. One is universal masking. Anytime you're outside of your home, you're wearing a mask. It is incumbent, I think, on the Indian government. Also, this is a place where international community can help. And higher quality masks are really important, particularly with some of these more contagious variants, that we think high quality mask wearing is really, really critical. So getting masks out to people, but absolutely making sure people are wearing masks outside is critical. Number 2 is you gotta basically stop all indoor gatherings as much as possible. And so things like restaurants, stores, anything that is indoors where people can congregate is a huge, huge problem. So that has got to be sort of the next big priority. You know, outdoors is generally safer. Now, a political rally is not safe. A cricket match is not safe. But I don't think you have to lock people inside their homes. And if people are wearing masks and they're outside, that is reasonably safe to do at this point. The issue is this is such a big problem that there is no magic bullet. So somebody asked, is it too late for test and isolate? Sure, if that was your only strategy, that wouldn't work. But testing and isolating might be able to identify and block 20% of transmissions. I will take a 20% reduction in transmissions, because then you throw in masking and social distancing and getting rid of crowds, and we're starting to make real progress. Obviously, on the healthcare side, there's a lot to be done. I love the idea of, you got to have field hospitals. India just does not have enough hospital capacity. Most of the therapies that are needed here are not all that complicated. Oxygen, obviously, making sure people get dexamethasone when they get more severely ill. There are a few other therapeutics. This is a place where I think both international community can help. And then we've talked about vaccines and got to keep going on vaccinations. I think if India did all of these things pretty assiduously, you could see the kind of the trajectory level off and come down in the next few weeks. Remember that sickness and hospitalizations usually follow 7 to 10 days after infections. So whenever you see that drop, you're still going to see hospitalizations rising or people getting very sick. Deaths follow even after that. So the infection numbers are really the key thing to look at, and then positivity rate is a really key thing to look at in terms of predicting where things are going. And right now, based on everything I'm seeing, things are going to get worse over the next few weeks, not better.
On the vaccines, just one point. New York Times again reported this morning, and you would know this data very well, actually, Ashish. Only 8.6% of India has been vaccinated, about 100 million people out of 1.3 billion, until April 15th. And the announced plan surprised me. It says 300 million by August. That is also very small, given the size of the problem and the size of the nation.
It's not enough.
So, how is this because the backlog of not providing raw materials, which could have led to greater vaccine production, is a problem? And Barkha is raising a hand, so she will also say
just a two-finger before Ashish responds. This target was set before this calamity was upon us. Right?
I see.
This vaccine, the framing of this particular number was when we thought we had enough vaccines to gift away, and we could, this was the target then. If this is the target now, we're not going to get out of this in 4 to 6 weeks. No. It's just not enough. It's simply not enough.
So my best guess on vaccinations is that with India, so let's start with two things. You're going to see vaccines mostly driving infection numbers down once you get to about 45–50% of all people in India vaccinated. We are very, very far away from that. That's like 600 million people, and we're at 100 whatever we are at. So that's a huge, huge challenge. I think even when you get to 25–30% of people vaccinated, it will start really helping. It'll start slowing down the spread. So you have to see this as a battle where you have 5 or 6 different tools, and it's a very difficult battle, and you have to use them all. And if you say we're going to leave one of the tools behind, then everything else will have to be much harder. So if we do all of those things, get vaccinations ramped up, mask wearing, social distancing, testing, isolation, throw it all out there, India can definitely get this under control, but it's going to be a difficult battle.
And the second question was for Barkha.
Yeah, I think it was
political economy.
Yeah. So can you specify the question on political economy?
I got
the center in the state, yes, but what do you mean by political economy?
So essentially the question is around, could you disentangle for us the role of Modi government in this surge?
No, I've already listed the mistakes. Yeah, sure. I've already listed the mistakes I thought that the Modi government made. misreading the problem, misdiagnosing the problem, not putting contingencies in place, over centralizing the vaccine program, over controlling the states, not doing a targeted vaccine program and allowing Maharashtra in the beginning to get more vaccines, and above all, to continue with these rallies, which is not Modi alone, certainly. There are other political parties that have to take responsibility for it. All of them did it in Bengal. And in Uttar Pradesh, I think other parties should refuse to participate in it. Why are we waiting for the election commission? It's all very well to deflect the responsibility on election commissions. The Americans have an example in what Biden chose to do. Rahul Gandhi did it at some point, but he also did it very late. So I think there's been a kind of political callousness. And, we've been going on in India about whether the IPL, the cricket, should carry on in a parallel universe, or whether it should make some reference to the calamity. But it's almost so much more offensive to me that the rallies have carried on, because they're actually physically dangerous. Right. So I think I've very clearly listed the mistakes that I do believe have definitely been made by the administration.
On the IPL does not have any spectators and crowds anymore.
Yeah, but there's a bit
from the beginning.
My suggestion on the
they're
IPL,
in biosecure bubbles. There are moral issues one can raise, but I think the physical dangers.
There's no physical danger.
There's no physical. I think the virus cannot spread from there because of the way it's being handled. The spectators in the Narendra Modi Stadium when England was visiting, that was certainly a very big issue, right? Right.
But
and then just to one more thing, Barkha, I think the way Ashish has summarized from the science perspective, the problem, he says February 11th, there were about less than 10,000 infections a day in India. By February 26th, you were getting at 18,000 infections a day. And if a government is paying any attention to public health specialists or scientific community, somewhere in the first half of March, there should have been a vigorous government intervention based on probabilities of spread. Right? So Ashish's analysis helps us understand where the problem is in the first half of March.
Absolutely.
Government not intervening vigorously has worsened the problem enormously.
Let me just put it to you like this. Had the vaccine program just started 2 months earlier, had Maharashtra just been given the vaccines that they wanted a month earlier, had the foreign-made vaccines that have finally been given approval after aggressive denials that they would ever be given approvals 2 months earlier, we would not have been in this calamity. And I do believe that in 2020, the mistakes made by administrations were genuine because the entire world was grappling with something that it did not know how to handle. But this has been careless. And when this passes, there will have to be accountability for the failure. 2 months is making the difference between mass deaths in India. And when I say mass, the word does not describe what we're seeing. It is an indescribable sort of desolation that this country is experiencing. And when you think of the fact that 2 months could have made the difference in just simply intervening and providing those vaccines, it's a bit chilling to think who will stand up and take responsibility for that.
Can I say,
Ashish, any concluding thoughts? Yeah, we are out of time.
2 months in a pandemic is a lifetime. It's many lifetimes. We have seen over and over again that when action is delayed by a couple of weeks, it can have calamitous effects. So it's really quite tragic. Let me make one quick point on that third question. The issue of global vaccinations is unfortunately far more complicated than just an IP issue. And we have a long history in public health, and I suspect in other areas, where once confronted with a complex problem, you fight about a simpler version of it that won't actually get you where you want to go. We could make all the IP of all the vaccines completely public and open tomorrow. And I don't believe it would add a single dose of a vaccine for anybody to get. Because along with IP needs to come a lot of technology transfer, a lot of technical know-how. these are not easy things to make. This is not like Cipla making medicines. This is a very different ballgame. There is, I still believe, one country that can drive global vaccinations, and that is the United States, because between resources, technical know-how, the power of the Biden administration's ability to bring major manufacturers together, do better licensing, give away IP. I don't think that to me is such a concern. There's a lot to be done. And I am now expecting that, given where America is with this pandemic, clearly turning a corner and heading in the right direction, there is no longer any explanation for the Biden administration to not be fully and completely engaged with partners around the world in getting the world vaccinated.
All right, that brings us to the end. We're slightly over, but it's time to thank Ashish once again, and Barkha a third time, I think. Ashish has given us 2 seminars, Barkha has given us 3. So thank you very much for enlightening us. And perhaps we'll have to turn to you again, and I hope you'll join us again. It seems like both of you are saying it's going to get worse before it gets better. And in the next 4 to 6 weeks, a lot of people all over the world, of course, mainly in India, but also as in the rest of the world, will be watching what happens to this awful dance of death, Thank you both. And thank you all. Thank you to the audience for joining us from different parts of the world.